Welcome to Metabolic Mind, where we provide information and resources at the intersection of metabolic health and mental health, as well as the use of metabolic therapies as mental health therapies. I'm your host, Dr. Bret Scher. At Metabolic Mind, we're helping revolutionize the treatment of mental illness. If you or someone you love lives with a mental disorder, including serious mental illnesses like bipolar, schizophrenia, or major depression, as well as other psychiatric conditions, this is an important topic that could help you ensure you're getting the best treatment to manage your symptoms, optimize your quality of life, and even in some cases, send your disorder into remission. Now, many people are surprised to learn that numerous studies indicate that those with poor metabolic health, such as insulin resistance, metabolic syndrome, prediabetes, or type 2 diabetes, they have a significantly increased risk of serious mental illnesses such as bipolar disorder, major depression, or schizophrenia. And it appears the correlation holds in the opposite direction as well. Those with serious mental illness have a higher likelihood of having metabolic dysfunction. While this doesn't prove causation by itself, it's certainly worthy of attention and should make us curious if metabolic therapies or metabolic treatments would improve the symptoms of mental illness. And emerging evidence says that yes, it will. And that's what we aim to explore here at Metabolic Mind. Now, Metabolic Mind is a nonprofit initiative being launched by Baszucki Group, a philanthropic venture started by Roblox founder and CEO David Baszucki. David and his wife, author Jan Ellison Baszucki, had the idea for Metabolic Mind after their son, Matt, recovered completely from a serious mental illness, in this case, bipolar disorder 1, using a therapeutic ketogenic diet, a metabolic intervention originally designed for epilepsy. They started funding research on metabolic therapies for mental illness and launched Metabolic Mind as an educational resource for people interested in learning more. They also want to offer a message of hope that freedom from the burden of mental illness is possible. But you're also probably wondering why you should trust what I have to say, right? I'm just the messenger, and we know the internet is full of advice that's of questionable nature and can be confusing to know where to turn for trustworthy advice. Well, I'm Dr. Bret Scher. I'm a cardiologist and lipidologist, and I focused on preventive medicine for over 20 years. And about 10 years ago, I began focusing on metabolic health and eventually became a worldwide expert in metabolic health and the ketogenic diet as a therapeutic intervention. I was the medical director at DietDoctor.com for over 3 years, and now I'm the director of Metabolic Mind, where we focus on providing scientifically accurate information about metabolic psychiatry that's practical and applicable to help individuals change their lives for the better. Back when I started in cardiology, it seemed that few were discussing the connection between metabolic and cardiovascular health. But over time, I and many others in the field have tried to help the field see this important connection. Well, now I see the same thing happening in psychiatry. And now it's our turn to help everybody in psychiatry see this important connection. But here's another important point about trustworthiness. I highly value the statement that the strength of the recommendation should match the strength of the evidence, and we need to be clear how strong the evidence is at every step. Much of what we discuss at Metabolic Mind is based on lived or clinical experience, and that's okay, as long as we're clear about that, and we're also clear when the studies are strong or less strong. In our channel, we'll be bringing you interviews with scientists and clinicians who are pioneering the use of metabolic therapies for mental illness, and who have seen transformation in their patients' lives and their patients' health with their own eyes. But I want to be clear, our channel is for informational purposes only. We're not providing individual or group or medical advice, nor establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or your medications. Now, I used a number of different terms in this video, such as metabolic health, metabolic therapies, nutritional ketosis. I know these can be confusing terms to understand completely. So in our next video, I'll explore these terms so that you can better understand what they mean, how they relate to each other, and how addressing them may impact mental illnesses. And if you found this video helpful, please click the thumbs up and subscribe button, and please share it. Share it with your friends, your family, and your healthcare practitioner. Our goal is to spread this information as widely as possible, and you can help us do that by sharing it and also by liking and subscribing. All right, so we'll see you here next time at Metabolic Mind.